Hi there, I'm Asha Tomlinson with CBC Marketplace, and we're live on Facebook, on YouTube, and on Twitter, and we're here to answer questions about vaccines. We know that nearly half of Canadians have some concerns, some doubts about vaccine safety and about the efficacy of it. And so there's a lot of misinformation that's typically spread online, and because it's out there and it's quite pervasive, people are questioning a lot of things, and that's why we want to further our investigation that aired last week, Friday, and deconstruct things for you here. So we want to answer questions that you have, and we have guests that certainly understand vaccines. They know the research and the science inside out, and they're here to answer any of your concerns. Dr. Vinita Dubey, Associate Medical Officer of Health with Toronto Public Health. Thanks for being here.
My pleasure.
And Katie Pedersen, Associate Producer with CBC Marketplace. I mean, you've been deep in the research for months upon months, and perhaps, we can't get that out there in a 20-minute piece, just how much research and how many things you've looked into, but we're gonna deduce that today as well. So let's just start off, Dr. Dubey, about some of the biggest concerns, three of them being side effects, serious side effects from vaccines, vaccine ingredients, and big pharma. Let's go one by one, and then we'll take your questions as they come. So let's talk about the serious side effects from vaccines. What's the science? What are the stats?
We know that vaccines are not without risks, and so they do have side effects. The serious side effects, though, are rare, and rare means about 1 in a million. And so, well, what does 1 in a million mean? Well, are you concerned about getting struck by lightning every year? That's the risk of 1 in a million, of getting struck by lightning every year. And so most people are not concerned about that. It's a very low risk, and that compares the risks of those serious side effects of vaccines.
And Katie, what did you see in your research dealing with this?
With side effects?
Yeah.
I mean, people were very concerned. A lot of the side effects that people wrote to me about were not actually real side effects that the science has even found associated with vaccines. I mean, the real science shows that there's encephalitis, could be a possible outcome, allergic reactions. But a lot of the things that people were worried about as side effects of vaccines were not actually found in scientific studies.
The big one being the link, of course, the MMR vaccine, mumps, measles, rubella vaccine, and that link to autism. Is there any truth to that?
There's no truth to it. And we know that the study that came out 2 decades ago that suggested a link was funded by, there were conflicts of interest by the physician who actually put forward the study. The physician made fraudulent data, and the link has never been proven since.
Let's talk about vaccine ingredients. We actually have some questions coming in, so we're going to get to them very shortly. Let's talk about quickly the vaccine ingredients. Particularly, I know people have concerns with formaldehyde, with aluminum, with mercury.
Yeah. Mercury was sort of the original scare to do with vaccines, and people were so worried about it that they actually took it out of almost every vaccine. It only exists in, I think, one type of flu vaccine now, but there was never any issue. I mean, to compare, the amount of mercury that's in that one flu vaccine is about the same as a 3-ounce can of tuna. Like, it's not a lot of exposure to mercury. It's not a dangerous amount of exposure. Aluminum is sort of the big thing right now that people are worried about. Again, it's when they say a small amount of aluminum, people don't know what that means. What is a small amount? We're talking like 1 pill of buffered aspirin has the same amount. It's 10 times, actually, 10 to 20 times the amount of aluminum as a vaccine. So
you can find it in water, you can find it in breast milk.
Yeah, they all have aluminum in it. It's a very,
exposures.
very pervasive, like in nature. It's a natural metal. And formaldehyde's similar. A pear has 120 times as much formaldehyde as one vaccine. So these are not huge, they're not toxic exposures of these elements.
And I mean, there's the big pharma profiting off of this, exploiting the vaccine industry. I mean, we can say 2 to 3% of global pharmaceutical profits come from vaccines. Many of the childhood patents have expired. So, I mean, physician offices often lose money on the administration of vaccination. Can you speak to that?
Well, I think the one thing that's important to say that when we make vaccine recommendations, we distance ourselves from Big Pharma. So the Canadian National Advisory Committee on Immunization, there is no influence from Big Pharma when they come out with their recommendations for who should and who should not receive the vaccine. And so they are separate. The recommendations are separate from actually the vaccine manufacturers.
Okay. Well, let's get to your questions because that's what you are here for. So Kaylin Keach on Facebook asks, what about my child who developed whooping cough after the vaccine? It is a listed adverse event. It happens.
So we know vaccines do not work 100% of the time. Depending upon the vaccine, something like measles, mumps, rubella, about 95% effective. You can still sometimes very small time get the disease from, even though you've been vaccinated. But what we do know is that sometimes if you get the vaccine and you've been vaccinated, you actually get a milder course. And we actually have found that with even the whooping cough vaccine, that you can get a milder case of pertussis or whooping cough than if you were never vaccinated.
Well, it's interesting. I mean, we had 2 moms in our piece. One, Tara, who she had 7 kids at the time, right? And all of them developed whooping cough. But how bad can that illness get?
Whooping cough is called the 100-day cough, and especially in children where they get that cough, 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 and it's called an apneic spell where they can stop breathing.
Wow.
They can vomit. It can be very serious. You can lose the oxygen in your brain when you have those spells where you stop breathing. It can be extremely terrifying and extremely serious. And to be able to prevent, I mean, we've had deaths in North America from whooping cough or serious illness in those little infants. We should be able to prevent that, especially because the vaccine is very safe.
One
You
thing
wanna get something to say, yeah?
Yeah, just something that people often wrote me about through this process when they knew that I was part of this investigation was that, can I get the disease from the vaccine? And I think in a lot of, especially in countries where there's outbreaks, they might be doing, vaccines really quickly, trying to get to everybody, and then suddenly people are like, oh, I've got the vaccine and I still got the illness. But some of these vaccines take a couple weeks to become active in your body and to actually work. So same with flu vaccine, people are like, oh, I got the flu after getting the flu vaccine. Well, you probably were exposed to it within those 2 weeks before it actually became effective in your body.
Right. Okay, Janet Smith on Facebook asks, millions of people have been vaccinated over decades with no ill effects. Why is this even a thing?
We know that there's misinformation out there, and I think it's a really good point. We should look at our past to see that vaccines work and that they're safe, and we should continue to use them. We need to remember that the diseases for which we vaccinate are still important. The risks are still here in a place like Toronto, but we know that well-intentioned parents are reading things online in social media groups, and they're getting half-truths. And so it's causing doubt in their mind, and so they're questioning vaccines. And that's okay if they question, but they need to go to a credible source to be able to get their questions answered. Otherwise, they may go down the path to think that vaccines are not safe.
Yeah, I mean, she's right. These vaccines have been tested for years and years and years. Aluminum has been in vaccines for over 30 years now. So if we were to take that out, we'd have to replace it with something else that we wouldn't have 30 years of research on. We wouldn't have the confidence that it's safe as much as aluminum is.
But they say, that people have been vaccinated with no ill effects. Why is this even a thing? I mean, we haven't really seen sort of the worst of some of these diseases in a long, long time. And I mean, that is because vaccines have been working, right?
Yeah, they say that vaccines, because they've worked so well, that's why people think that they're not necessary, actually, which is,
Catch-22.
Yeah, exactly,
Yeah.
exactly. But we don't have to say, well, in Canada, it's not such a big deal. We can actually look to our neighbors in Europe, even in the US, and we can learn from their experiences where the vaccination rates of measles dropped, not by a lot, in some places by 10, maybe up to 20%. And then they saw outbreaks of these illnesses. And so we know that that will happen here if we lose our guard.
And if you have a compromised immunity, or even if you're one of the vulnerable groups, young children or the elderly, it can be even worse to get that.
It can be even worse, yeah. And so that's another reason why we need to be more vigilant to make sure we're all vaccinated, because we're actually protecting other people. It's community immunity. It's not just for yourself.
Okay, Janet Thompson says, why is there a chickenpox vaccine now? We had chickenpox as kids. Majority of people survived. Why now? Why are there so many vaccines given at once or within 2 years to infants? So let's just break that down one by one, because it's a two-pronged question there. So we had chickenpox as a kid. Majority of people survived. Why now?
Well, first of all, we didn't have a chickenpox vaccine 2 decades ago. A lot of people don't realize that chickenpox, while most people, were ill, but then they got better and they had no ill effects, but there were a small proportion of children who got chickenpox and got flesh-eating disease, and it was devastating. And so the reason why we give the chickenpox vaccine, one of the big reasons is to prevent those serious complications. So that's one of the reasons why we have why we give the chickenpox vaccine, and we are seeing with the chickenpox vaccine that now chickenpox is less and less common in childhood, and so we're protecting that severe flesh-eating disease from occurring.
Oh my goodness, that sounds awful. Why are there so many vaccines given at once or within 2 years to infants? I mean, I've just gone through this. My baby, now toddler, he had to go through a lot, and I know that I've seen multiple times online that there's an argument to space it out, and that perhaps it's not as much going into this young child. What do you say to that?
Yeah, so the vaccination schedule has been developed balancing the risks and benefits of when you get the vaccine. And what we want to be able to do is to provide the vaccines early enough to children so that they don't get exposed to these illnesses and so that they're protected. And so that's why we give something like the whooping cough vaccine at 2, 4, and 6 months of age, because we know that when you're less than 1 year of age, that's your biggest risk. What people think that you're getting too much vaccine at one time, but actually what we call the antigens, the pieces of a vaccine that are in each vaccine, are actually much less than what an infant's immune system can handle. For example, an infant's immune system can handle up to 10,000 antigens, and what's in a vaccine is much less than that. In fact, when an infant gets even a cold, they're getting stimulated with more antigens than they would even in routine childhood vaccinations.
And I was just going to add, a lot of parents were worried that if they're getting so many vaccines within a year or two, are these adjuvants like aluminum building up in their body, and could they reach toxic levels? And I talked to a microbiologist and a toxicologist about this, and they said, no, that product is flushed out of your body within a couple days. So it's not like you're getting a vaccination every day to stack it up. That's gone within a couple days. You're not getting your next vaccine for a couple months.
Yeah.
So there's no risk there.
Okay. Here's a question from Stephen Jones, and this is about the studies behind a vaccination. Why are there no placebo-controlled safety trials on any of the childhood vaccines?
Actually, before a vaccine becomes licensed, they are studied with placebo-controlled trials. And the amazing thing about vaccines is actually once a vaccine has been licensed, we continue to do ongoing studies in the world. So they're called post-marketing surveillance. Those are not placebo-controlled studies, but those are every single person who's received a vaccine. If they have a side effect, especially a severe side effect, it has to be reported and it's kept count of. And we know how much we would expect to see, for example, a severe side effect. But if we're seeing more of it, well, that might be cause for alarm and cause us to do something about it. Before every vaccine gets put on the market, each individual lot is tested to make sure that it's safe and secure.
I talked to Natasha Crowcroft about this, and she said that it was it's funny, the worry that people have about the placebo and that there's not a placebo in the test. Placebo actually would make less side effects, because if you're using a placebo and these people got a headache from the vaccine and these people didn't get the vaccine but they also got a headache, that would cancel it out. So you wouldn't report that. Whereas if you're not using a placebo, you would report the headache regardless. So there's actually potentially less side effects than is actually reported because they don't use a placebo.
We're getting a lot of questions. We want to continue to encourage you to get them in. Any question you have about vaccines, and this is just furthering our investigation into the fact that nearly half of Canadians are vaccine hesitant. They have some concern about the safety and efficacy of vaccines. So we're live on Facebook, we're live on YouTube, we're live on Twitter. Dr. Vinita Dubey is here along with Katie Pedersen from Marketplace. Dr. Dubey is with Toronto Public Health, and they're here to answer your questions. Now, we've gone through quite a few, but there's a lot of people who are, have a lot of things to ask. Christine Perdue says, do you think they will ever make it illegal to post anti-vax misinformation on social media? I'll throw that one out to you first if you want to go, because I know this is something that you've really been, pouring through.
Yeah, I talked to one of the lead people in California from Facebook about this, and their concern is that they don't want to be, the information police. They don't want to be the ones to decide what's true and what's not true. But at the same time, they're aware of the fact that misinformation is being spread on their platform. I mean, 50% of all of the anti-vax misinformation ads out there were purchased by just 2 people. So, there's 2 people who are spreading all this information. Because of that, they actually shut down any anti-vax ads, so you can't pay to spread this information. And they have put in a lot of sort of safeguards to try to flag misinformation. They've consulted with experts around the world as to what are the more pervasive lies that are being told about vaccines. But that being said, it's really hard for the algorithm to catch this kind of stuff. I mean, when I went on to one of the most famous anti-vaxxers websites or Facebook pages, in the recommended pages, it was recommending other known anti-vax misinformation sort of hubs, right? So I'm like, this isn't working that well, but I mean, it's a start, right? And this only came into practice in October, so.
I'm sure it's hard to filter through too when the terms are changing. So you no longer necessarily see vaccine in the title of a Facebook group, for example. Instead, you're going to see informed consent or medical choice or medical freedom. So things are always evolving, and you can only imagine for Facebook to or any of the social platforms to continue to filter through. It must be a hard task.
Yeah, and at the event, we talked to people that are sort of in charge of some of these groups online, and they're saying that they might sort of try to appeal to crunchy moms or to people who are more interested in alternative health, and they come at them sort of from the side. Mothers that might not have any concerns about vaccinations are being exposed to misinformation through their other interests because they're being specifically targeted.
Okay, we are getting a lot of questions coming in right now. So Carter Peckett asks, what flu vaccines are recommended this season?
In Ontario, there's a high-dose vaccine that's available for those who are 65 and older, and then there's the regular vaccine that's available for anyone who's 6 months of age and older.
And I know there's always concern about the strain. I mean, it's often different year to year.
Yeah, so the regular vaccine has 4 strains in it, so it protects against 2 A strains and 2 B strains. And we see right now in Canada that 2 of the A strains and 1 of the B strains are actually circulating.
And it seems to be, pervasive, because I know that just recently this week, I know a young man had passed away from the flu. So I'm not sure, what's behind it, whether he had the vaccine or not, but it's definitely something to be concerned about, right? Because I know some people feel like the flu is no big deal.
And I think if you're young and healthy, you might get sick for a week or 2 and be able to bounce back. But the real risk for the flu is young children, those who have a weakened immune system, those who have a chronic illness. If you have something like asthma, it can make your asthma quite worse. And so that's why it's important. Actually, when you get the flu shot, even if you're young and healthy, you're actually trying to prevent the spread to others as well.
And some of the experts told me that even on the years that the strain or the vaccine might not be as effective as other years, it will still make the the effects of the flu better for you. So even if you get the flu after you've got the vaccine, it won't last as long. It won't be as dramatic as it would have been if you hadn't got the vaccine.
Bernard Leckler on YouTube says, how do I go about catching up with vaccines for a child who has never been vaccinated before?
It's not too late. So in Ontario, we have what's called a catch-up schedule. So based on the age of the child, the physician or nurse could start the vaccine on a publicly funded schedule to get them caught up.
At any age? Or?
At any age,
Okay.
yeah, for sure,
Okay.
absolutely.
Jennifer Alvarez on Facebook, will vaccines affect blood sugar in patients with diabetes?
Vaccines are actually recommended in people who have diabetes, actually, because diabetes can sometimes make, if you get one of these if you get one of these infectious diseases, it can actually make your diabetes worse, and it can actually make it harder for you to get better from some of these illnesses. Flu is, for example, it is one of the examples. Pneumococcal disease that can give you a blood infection is another example. So it doesn't make your sugars worse. It doesn't make them better, but it may protect you more just because you are diabetic.
Teddy Crossan on Facebook says, I got the MMR as a kid. I've heard this before. I'm nearly 40. Do I need to get vaccinated again? There are people who are wondering, do they need to get vaccinated again in their adult life?
No, it's a good point. And actually, there are adults who are born between 1970 and 1996 who were vaccinated, were not against vaccines at all, got their routine vaccinations, but actually only got one measles, mumps, rubella vaccine as a child. And so what I would say is if you're 40, you're in that cohort, I would say check and make sure that you've gotten 2 doses of the MMR vaccine. And if you haven't, get that second dose, because we know that that second dose gives you more protection against the measles. But once you've had 2 doses, you don't need any more doses.
And what if it's hard to find the record?
If you have no record,
or your
and
parent doesn't remember.
Yeah,
right?
absolutely. So if you're not sure, then you can get vaccinated again. That's
It's
safe.
okay.
And then, but what I would say is keep your vaccination records with your passports.
Yeah.
They are important documentation.
Definitely, and for your kids
And
too.
for your kids too, yeah.
Isabel McIntosh on Facebook, why has the whole vaccination schedule not been tested, given the amount has more than doubled in the last 20 years? I believe amount, she must mean like the schedule
Quantity
of vaccines, like how many we get.
You know what, you could say that the childhood vaccination schedule is actually being tested every single day, every time a child is getting the vaccine. Because every time a child is getting the routine schedule, we're checking to follow up on the side effects that they've had, and if there are any severe side effects, to be able to report them and to be able to monitor them. And so we know that that childhood schedule is actually safe and that it's actually working to prevent the diseases, because we know that the disease rates are actually going down as well.
Teddy Crossan, nope, I'm going over the Teddy already. So Kelly Still Crown on Facebook, can they start creating vaccines to be made from a holistic approach?
You know, sometimes there's this dichotomy between natural and unnatural, and it's actually not fair, because a vaccine, what it does is actually, it boosts your natural immune system. What it does is it gives your body, you know, maybe a small piece of a particle of a virus or of a bacteria, and your body thinks that it may have that infection, and your own body produces a natural immune response to protect your body. So should you see that real disease, you'll actually be protected. And so I actually think that that's pretty natural. And I think let's do it in a preventative way that works, rather than actually getting the disease, getting the illness. I work in the emergency department. I see people who get very sick all the time, and I want to be able to prevent those very severe illnesses, and I'll do whatever I can to do that.
Well, what about the argument, and you know, we got this argument multiple times in our investigation, that, well, if you get these diseases, like the measles, for example, you have lifelong immunity.
It's true that the natural immunity gives you a different kind of protection compared to vaccine protection, but you can't be guaranteed that if you get the measles disease that you're actually going to recover from it. And I think that that's the risk that we have to be very clear on, that these diseases can actually be extremely dangerous. And even something like measles, you can actually recover from it and then years later get some of the sequela from it, pansclerosing encephalitis from measles, which can be very severe and is devastating. That's only from natural infection.
I think it is important to note that all of the ingredients that they're injecting into a person is flushed from your body within a couple days again. So, I mean, the only thing that's left in your body is like the lessons that it's learned about how to fight this disease, which is all natural. I mean, it's all antibodies that are in your body. So it's not like there's some foreign substances that we're pumping through your child. Like, these things are just there for a minute and then they're gone, and it's just a lesson learned.
We have Carmen Westfall King, who wants to know, if there's no harm in waiting, then why can't parents wait until kids are a little older?
I don't think it's right to say there's no harm in waiting. We know that the longer you wait, you can be exposed to some of those diseases and you can get them, and then you've lost the benefit of actually getting vaccinated. And we see that. And so the reason why the schedule is there and why it's timed in the certain way that it is to be able to protect children. We know, for example, something like meningitis is most common in the first year of life. Well, if you wait until you're 5 years old to get the meningitis vaccine, your biggest risk was in the first year. And so that's why you want to get protected.
For people who may not understand, though, I mean, how bad can something like that be for a baby?
Some of these illnesses can be devastating for very young children. We live in an environment where we haven't seen some of these very serious diseases, but most parents of very young infants know that sometimes just a cold, sometimes your child just has a cold, and it can be extremely difficult to take care of your child. And so I think you have to recognize that if they actually really got something like whooping cough, or they got chicken pox at that age, it could be actually devastating for that child.
And I mean, Asha, you talked to Tara and Megan in our piece, who were, they felt that way. They thought their kids were too young. They wanted to wait till they were older, and they did. But by the time that they had actually decided, okay, now I feel like they're old enough to vaccinate and I feel more comfortable, it was too late, and everyone got whooping cough, and it was really an eye-opener for those moms.
And they were saying if her child was even in the first few months of life, it would have been a much scarier thing for them, and potentially a much scarier outcome, because you just don't know those first 3 months up until a year. It's a very scary time in terms of what's happening with the baby and as their body develops, right? So Brenna Bloodworth wants to know, are single-dose flu vaccine vials or multi-dose flu vaccine vials more commonly used in Canada?
We have both of them available, and so if you had a preference for whatever reason, you could probably get either. They're equally effective. The multi-dose vials have 10 doses in a vial, and so you just draw it up and give it, and then the single-dose vials come with a syringe attached. But it's the same vaccine in both.
Your questions are coming in. Thank you so much. We're trying to get to them as quickly as possible. So hold on tight if we haven't read out your question yet. But David Y on YouTube, why can't you get the MMR, the mumps, measles, rubella, separately? Why bunch them together? Higher risk of adverse reaction?
Some people ask that. I want a measles-only vaccine. I don't want mumps or rubella. It's just not available in Canada, and there's no reason to think that the combined vaccine is more harmful. There's actually another combined vaccine, measles, mumps, rubella, and chickenpox, actually. And so combo vaccines don't necessarily mean because they're combined, they're more harmful.
And I know, we talked about sort of where that idea came from, and it's Andrew Wakefield's study back in the 90s, if you want to touch on that quickly.
Yeah, Wakefield's study, it was of 12 people. It was found to be fraudulent. He actually lost his license for it because of the way that it was conducted. He was making money from a lawyer who wanted to sue, like basically the kids that were involved in the study were wanted to make money from their illnesses, and it was a whole issue.
Yeah, but he was kind of the one that sort of put it out there,
that
in this modern
doses.
movement,
yeah.
that single doses would be safer than multiple ones like MMR, which he fraudulently linked to autism.
And he did get that published, and I think it's important to note that just because a scientific study is published in a scientific paper or publication, it doesn't mean that it's necessarily proving everything else that's out there is wrong. You got to look at sort of the bigger picture and what the wealth of information that's out there is, and we did that. We took a lot of those studies to experts, and we said, why is this wrong? And one example that some of the people that were concerned about vaccines talked about is that there's not enough evidence to prove that autism isn't linked to vaccination,
MMR,
which is just not true. Like I read the study that they were talking about, and it says, you know, the evidence to show a link between MMR and vaccination is lacking. And to me, I was like, okay, it's lacking. Does that mean that there's just not enough evidence? Do they need to do more? So I took that to a microbiologist and a toxicologist, and they said, no. So the word lacking in science doesn't mean how you think of it in colloquial terms. Lacking is one level below a weak correlation, which means that there's actually zero evidence.
Right.
It doesn't mean that there's not enough. It means that there was zero correlation at all. So it's a lot of the times you can't trust yourself to just read a scientific paper and understand it. You got to take that to somebody who understands the science.
Yeah, take it to your
like
doctor.
A doctor.
And Dr. Dubey, can you deduce that for us and sort of debunk that myth that's out there? Because that is, I mean, we could arguably say is the biggest myth around vaccines, is that the MMR vaccine can cause autism.
The MMR vaccine does not cause autism. Let's be clear on why people are concerned about autism and what the real causes are. Let's actually really put our effort and our research into what's causing autism, and let's prevent it. But let's not put children who have autism at undue risk for these infectious diseases. They're not getting vaccinated because they think somehow there's a link. Let's be clear on what the science shows.
Okay, let's get back to the questions. Kayla Nordoff on Facebook wants to know, I mean, there's 3 questions here. Why is there aborted cells in vaccines? We've kind of touched on why so many vaccines now, Kayla, and why the additives.
So the additives, or what's, you know, people define them as additives. Well, as Katie's talked about, the ingredients that are in vaccines are there for a particular reason. So the aluminum we talked about, it's there to actually boost the immune system, for example. A lot of the other things are there in residual amounts. And so one of the things that you'll classically read about misinformation is there are too many ingredients in vaccines, but actually vaccines don't actually have a lot of ingredients that are unknown. Whatever's in there is in there for a specific reason. Either to prevent it from getting overgrowth of bacteria, to make sure that it stays strong so that it will continue to work inside your body, for example. And then the thing about aborted cells, there are no aborted cells in vaccines. In fact, there are no human cells that are actually in vaccines. Vaccines will contain particles of a bacteria, or a virus, a weakened virus, that, and then it might be preserved in certain ways, but there's actually no human cells, for example, that are in vaccines.
Thira Sumar wants to know, why doesn't medical science work on building or supporting a child's own immune system rather than getting so many vaccinations?
I don't think it's an either or, you know, like we have to work on making sure that the child is physically active, that they are in a nurturing environment, that they eat the right nutrition. Vaccines are part of that. And so I think we need to recognize that there are many ways in which we build a child's immune system, and vaccines are one of them.
And we have Dawn Riches on Facebook. My son has been vaccinated and still got scarlet fever. Why? Is that not included in vaccines?
Scarlet fever is caused by group A streptococcus, and that's actually a disease for which we don't have a vaccine.
Okay. Well, there you go. I didn't know that. That's surprising to me. Josie Martell on Facebook. There's no real way of reporting side effects, as many doctors won't report it. So research is not accurate even if they say it is. Why is that? I mean, you kind of just talked about the fact that you report it after every vaccine, right?
Yeah, and if you feel that you have your child, or you've had a side effect from a vaccine and that your physician is not reporting it, you can actually report it directly to your local public health department. And each health department will actually do an investigation of that report. And what part of our investigation, like we do hundreds of them a year, is to determine, is there another reason that could have caused this side effect? And even if there might be another reason that could have caused it, we still actually report it. We default on reporting it so that we can keep track and so that we can look for signals in the reporting. And so you can actually report directly to your local health department.
And an interesting thing that I learned throughout sort of researching this was the reason that we sort of monitor side effects afterwards is because these side effects are so rare. So, you know, a clinical trial for a new vaccine might have 10,000 to 20,000 people in it, which is already way bigger than many other pharmaceutical clinical trials, which often have like 1,000 people in it. So huge amounts of people, but to find a side effect that happens 1 in a million times, you can't even find that in a clinical trial. You have to wait and see to even get one instance of a side effect. So that's sort of like the reason that we're monitoring after it isn't because we're not sure that it's safe. It's because it's actually just so well documented.
Okay. Revolution on YouTube wants to know nasal spray vaccine versus traditional needle vaccine.
So this year, the nasal spray vaccine is not available in Canada. So this year, your choice is by needle for the flu vaccine.
I believe it was available last year,
It was
correct?
available last year,
Okay.
yeah, and but the manufacturer did not produce it for Canada this year. Yeah.
Okay, and what would be the difference? I mean, I know it's not available, but
Yeah.
for someone wondering.
For kids, when you're deciding as a parent, a lot of the decision making becomes, does your child want a nasal spray versus a needle? There are some differences in the vaccine. The nasal spray vaccine is a live attenuated influenza vaccine, whereas the needle vaccine is an inactivated vaccine, but they both show that they work.
Okay. Wendy's Cafe on YouTube. Explain the dangers of measles, mumps, and rubella if you aren't vaccinated against them as a child and you contract them as an adult.
I think, you know, we've heard a lot about measles, but let's talk about rubella, because the reason why we vaccinated against rubella, the disease itself for a child or an adult is actually pretty mild. But if a pregnant woman got rubella while in pregnancy, that infant, that fetus could actually get what's called congenital rubella syndrome, and that can lead to deafness, it can lead to lifelong developmental delay. And so we want to be able to prevent that serious outcome, and that's one of the reasons why we give the rubella vaccine. The mumps vaccine, we actually had a mumps outbreak in Toronto 2 years ago, and it was occurring in adults. You can get swelling in your glands, but more worrisome is that adult males were getting testicular swelling, or women can get swelling of their ovaries, and it can also actually lead to encephalitis. And commonly, before we had the vaccine, mumps actually commonly led to deafness as well.
Wow. And you think about measles, I mean, I know that it's in the headlines a lot, so people are aware of it, but when you take sort of what happened in Samoa, which we talked about in our investigation, I mean, that really is devastating when you think about what happened with more than 80 people dying, and most of them children.
Yeah, almost all of them were young kids, and you know, when it's a population, 6,000 people get infected, and this is one of the most contagious diseases, right? If somebody walks through a room and has measles, you can not even see that person. You could walk in an hour later and still contract the disease because it's airborne. So it's pretty scary.
I've seen this a lot on social media since our investigation aired, and please let me know if you can respond to this, that the World Health Organization, this is from Lucy Perkins on Facebook, the World Health Organization stated at a vaccine summit in December how they stated there's no testing and that testing needs to be done to answer questions. Can either
So I know
one
a
of
little
you
bit about this.
debunk this? Okay.
Yeah. So there were a lot of posts right now in the sort of anti-vax sphere showing sort of hidden camera footage of, you know, a camera that had been snuck into this global summit on vaccine safety, and here's all these people admitting that it's not that safe. This is actually was live broadcast on the WHO's website. This is not a hidden camera. It was just zoomed in on what they're publicly displaying. You can access it. We can even put a link to it if you want. This is not, these are people that want to make vaccines as safe as possible because of the fact that they're being injected into healthy people. So a couple of the experts that I talked to, their threshold for side effects is very, very low. They won't, even if there's a 1 in 10,000 chance of there being an even slightly moderate side effect, they're not going to give you that vaccine because it's not worth it. It's not like it's being injected into somebody who is already sick and this can make them better. This is injected into healthy people. So the standard is super, super high. So they are always, always, always working to get, even if it's like a 1 in 10,000, 1 in 100,000, 1 in a million chance, how can we get that to 0? And they're always working harder to find a way to make vaccines safer. And that's a really good thing, and we should be really happy about that.
Nicole Long on YouTube wants to know, how effective is the shingles vaccine?
We have 2 shingles vaccines that are available. One is what's called a live attenuated vaccine, and one is an inactivated vaccine. And they both work, actually. And in Ontario, one of them is publicly funded. One is 1 dose, one is 2 doses. The National Advisory Committee on Immunization in Canada has actually recommended the 2-dose vaccine for everyone who wants to be protected against shingles, who's 50 and older. So, but you have to pay for it. It's not on any, it's not covered under any provincial schedule.
Oh, okay. How much does it cost, do you know?
I don't know what the exact cost is.
Okay, okay. And Ladybird on YouTube specifically wants to talk to you, Dr. Dubey, and she wants to know, why is there formaldehyde in some vaccines? I know we sort of touched on this off the top, but if you could elaborate.
So formaldehyde, if it's in a vaccine, again, is residual there. Formaldehyde is used to inactivate some bacteria. It's also like a preservative. One thing that you have to be aware of, though, again, it's the dose. And so formaldehyde is actually naturally occurring in our bodies, actually. There's formaldehyde in the cleaning products we use, in paper towels. And so we have to be clear that the formaldehyde that's in a vaccine is residual because of the manufacturing process, and again, is something that you actually already have in your body, and your body will be able to excrete it.
And it's found in much higher doses in real life, in
everyday
vegetables
exposures,
and,
yeah.
and fruits and things like that.
Yeah, you had some examples. I know you mentioned off the top of this.
Off the top of my head, I know a pear has 120 times as much.
Yeah,
so there's 12
my mind.
milligrams versus less than 1. So
yeah, yeah. Well, we're plugging away at all the questions here. Thank you so much for those who have written into us. We are live on Facebook, on YouTube, on Twitter, asking, I said on Twitter. That was quite formal, on Twitter. And we're answering, all your questions. We're talking about vaccines because we just ran an investigation on it inside the anti-vaccination movement. And this is after, a really fascinating statistic that nearly half of Canadians have some concern about vaccines and the safety and efficacy of it. So please, throw us some more questions. We're here for a little while longer, and Dr. Vinita Dubey is answering your questions along with Katie Pedersen from our team Marketplace, and Dr. Dubey is with Toronto Public Health. So Saren on YouTube wants to know, what if immune does not respond, I guess your immunity does not respond to vaccines, or if your immunity is weaker?
Right. So some people do not respond to vaccines, it's true. And so that's why we have the concept of herd immunity, or what we call community immunity. So, if your body actually doesn't respond to the vaccine, that's why we want everyone around you to be vaccinated, because the community immunity will help to prevent that illness from coming in and impacting you. For some conditions, we know, for example, that you're going to go on a medication that's going to weaken your immune system. Well, then, if we know what date you're going to start the medication and you have some control over being able to start it, you can actually get your vaccines beforehand while your immune system is strong, so that you mount that immune response before you go on that medication that might weaken your immune system.
And I mean, the vast majority of Canadians are vaccinated, so that herd immunity is quite effective here. But I know there's certain parents that wrote us that kind of feel like, well, those diseases don't exist here. So maybe I'm safe enough just based on the herd immunity. But there's a lot of countries in this world that don't have that access to vaccination. And if you want to travel, you can easily bring those diseases back home. There's a father out in BC that brought measles back to his community from taking his family, unvaccinated family, on a trip to Vietnam. So you kind of got to think of, even though it might feel safe and you might not see these diseases around, they're always circulating in this world. The only one that's been completely eradicated is smallpox. That's extinct now. Polio is getting close to extinction, but it's not there. So they do exist and they're around, even though you don't see them in your immediate sort of community.
Yeah, it's in your everyday life, I guess.
And we had measles come to Canada from, you can say, okay, well, I'm not going to go to Europe. I'm not going to go to those places where measles is circulating. Well, we had one year where Canadians went down south to say an all-inclusive. Well, there were people there from the UK, and guess what they brought with them? They brought measles with them, and they spread it in this all-inclusive down south in a country that doesn't have a lot of measles. And when everyone went back home, it spread. So you don't necessarily have full control over what you're going to be exposed to.
And measles is one of the most highly contagious diseases out of the
That's
group
right.
of them.
In fact, even in Toronto, people who were just in Pearson Airport, waiting in the waiting room, shared that airspace. They didn't know this person. The person had maybe left, and they actually got measles just from the airport. So very, very contagious.
Susan Hulcher on Facebook wants to know, drugs are recalled every day because of the toxic effects, but somehow vaccines are immune from this?
Not true, not true. We have had vaccines that have been recalled from the market, absolutely. And so I think it's a good question to say, when you say that you're checking vaccines, how do we know that you're actually going to pull the trigger? Well, one of the stories is for rotavirus vaccine. There was an original rotavirus vaccine that was available on the market. And what we were finding from the post-marketing surveillance is this rare side effect called intussusception, where your bowels would go in, telescope in and out, and would cause illness in children. And so that vaccine that was discovered, and that vaccine was actually pulled off the market. And when a new rotavirus vaccine came on board, we made sure that we had even more intense surveillance to make sure that that side effect was not going to occur.
Okay. Mike Benusik, I hope I'm pronouncing that correctly, on Facebook. If people don't have a family doctor, how can people get vaccinated?
So nurse practitioners can provide vaccinations. Some pharmacists can provide certain vaccines. Everybody should be able to have access to a doctor, so I know that there's a website in Ontario anyways where you can find a family doctor. Most walk-in clinics are stocked with vaccines as well. And so, what we do recommend is that you have that ongoing relationship with a practitioner so that you can have your questions answered. But if it's actually access to the vaccine that's a concern, there are plenty of options available. And for students who are in the city who might not have an OHIP card, for example, Toronto Public Health has clinics for them as well.
Yeah, I was going to say, definitely, I know you can get one at a clinic because I've done that before. So, but I also know it's sometimes hard, depending on where you live, to find a family doctor. So if you need in the interim to do that, then it's there for you.
And this was definitely an issue that we came across. A lot of the people that wrote Marketplace that wanted us to investigate vaccines were from areas of Canada where they didn't have access to a family doctor. So they didn't have anyone that they could ask these questions to, that they could read the information online, and they needed somebody to talk to about them and ask those questions. And it's a real problem in Canada that people don't have a person that they feel like they can trust with their children's health and their own health.
Yeah, for sure. Heather Cronk on Facebook wants to know, please explain why manufacturers are not held liable for vaccine reactions and adverse events.
I know that's commonly said, but as far as I know, that's in the US and not necessarily in Canada.
Okay.
Do you
have any insight in that?
Canada, I mean, they don't have certain countries do have these sort of compensation programs for vaccination specifically, and Canada doesn't have the same kind of situation that some other countries do. I'm not sure why that is, other than the fact that the side effects are so rare that and frankly the government needs pharmaceutical companies to make these products. I mean, these take years and years to research, to test. The clinical trials can take 10 years. That's not something that our government can pay for. They need the pharmaceutical companies to do that. And if not making them liable for the 1 in a million that might have an adverse reaction, if that's what it takes to encourage them to actually keep making those vaccines, then maybe that's a good thing. But it's a conversation that is worth having, I think.
And from what we understand, for the serious side effects, they are treatable.
Yeah, most of them are, absolutely. So, the commonest serious side effect is anaphylaxis, and that's one of the reasons why we say wait for 15 minutes after you get your vaccination, because if you get a severe anaphylactic reaction, we can give you an EpiPen to reverse it.
Right. And I think the stat, let's go back to it, it's 1 to 2 per million vaccinations where you see that serious side effect, like the allergic reaction.
And now sometimes there are other serious side effects that may take longer to heal. And so this idea of a vaccine injury compensation program, Quebec has one, for example. And I think it is a conversation that we need to start having in Canada, where you recognize that you get vaccinated for yourself, but also to protect others. And so if you're one of those people that gets one of those rare side effects and needs some help with rehab afterwards to get better, you got vaccinated to protect others as well. Well, we should be able to support you as a medical profession and as a community.
Okay. We have a few more questions. We have about 10 minutes or so left, and then we have to wrap up. But thank you for all your questions, and you guys, great answers. I'm really learning a lot. I hope you are too. So Betty Taylor Holland on Facebook wants to know, where are the vaccines made? Can you answer that? Yeah, I'm imagining in terms of who makes them. I'm not quite sure, but...
So vaccine manufacturing is a global production. It occurs globally. There are some vaccine manufacturers that make vaccines in Canada, some in the US, some in Europe. The vaccines, though, that are approved for use in Canada, Health Canada goes through to know where the vaccine is being produced, what process they follow, to make sure that, and then continues to do lot checks for the vaccines that are provided in Canada before it's actually provided. But it is certainly something that occurs globally.
Right.
But it's not that, because a vaccine was approved in this country that vaccine can automatically come to Canada. That's not the case.
Okay, yeah, so I would imagine she wants to know regional, so that sort of answers it there. Darren on YouTube wants to know, how many vaccines are 100% effective?
So this idea about 100% safe and 100% effective, it's not true. It's not true, and I'll be the first to tell you that. Vaccines have risks. They're not 100% safe, and 95% of the time, most of them work, but they don't work all the time. The flu vaccine, we say, is 50% effective, but that's okay. Actually, preventing yourself against the flu 1 in 2 times, considering it's the best protection we have, and considering that people in Canada die every year from the flu, I think that's fine for now, until we get a better vaccine. So there is no vaccine that is 100% effective. You could argue maybe the smallpox vaccine was. That's why we got rid of smallpox, for example. But it's okay that it's not 100% effective, because again, if you yourself may not mount an immune response to the vaccine, you're counting on everyone else around you protecting you as well.
And I guess you have to look at it, and I was saying this while I was rolling out the story on Friday, you have to look at it in its totality. Do the benefits outweigh the risks, right? And in most cases, it does.
Yeah. And the flu vaccine is a bit of an anomaly in that it is 50%, whereas almost all the other ones are closer to the 95, like very, very, very effective. Flu vaccine, like just 2 people in Manitoba died last week, which brought Canada to the double digits for flu deaths just for this season. And it's a 17-year-old kid and a 24-year-old young adult who are dying from flu. And even if even if it is only 50% effective, for the other 50% that it might not be effective for, they're still going to get less of a reaction to the flu. They're going to have an easier time with it. They're probably going to have a better chance of survival and a better chance of having a shorter amount of time with the disease. So it's still our best defense against the flu, even though that vaccine is definitely an anomaly compared to all the other vaccines that are available for children especially.
Yeah. Elke Hutton, I hope I'm pronouncing that right. On Facebook, I was told not to get vaccinated because I am allergic to eggs and had a reaction. Are vaccines actually cultured in eggs?
So there were some vaccines like the flu where they can be cultured in eggs and there might be residual egg protein. And in the past, we used to say, be cautious if you have an egg allergy, but we now know that actually it's safe in people who even have anaphylactic reactions against eggs. But if you've had an allergic reaction to a vaccine, what we do in our health department is we will actually refer you to an allergist so that you can check to see what exactly is it that you're reacting to, and to see whether there might be an alternative, a different brand of vaccine, for example, or getting the vaccine in a controlled setting to make sure, well, if you have a reaction, we can treat it right away to make sure that you can still get the protection from the vaccine.
Sarah Garadini Trivette, and this is our last question before we wrap up this Facebook Live. We're also live on YouTube and on Twitter. So she wants to know, every medication I've ever received has come with a medication information insert. Why is not the same done before receiving a vaccine?
Before you get vaccinated, it's important to get informed consent so that you know the benefits and the risks of getting vaccinated. Each vaccine does have a product monograph in it, which you could certainly ask whoever's vaccinating you for a copy. The product monograph is certainly not written for someone who does not have a science background. It's extremely complicated to read and to decipher. But most public health organizations have a fact sheet that will go through why you're getting the vaccine, what it will protect you against, what are the side effects and benefits of the vaccine. And so you could ask for one of those kinds of fact sheets in order to get that informed consent as well.
Okay, and then to break it down, I guess you can sit with your doctor or someone that you trust that has a medical background to sort of just explain it to you. Because I know some people just want to understand what they're getting.
And they should, absolutely. Like, that's what informed consent is about, is to be able to answer your questions before you actually receive the vaccine.
Okay, so we're gonna wrap up, and I just want to thank you so much for being here, by the way, illuminating discussion. What are your final thoughts on our investigation on the fact that nearly half of Canadians are vaccine hesitant?
I would say, first off, the questions are good. I mean, it's good to ask questions. No one is asking you to be blinded and to just go ahead and get vaccinated. Ask the questions. But if you're looking for the answers, look in the right places. If you're going to go online, but be aware that some of the stuff you read or some of the stuff you see is actually false. It's totally false. So go to websites that you can trust, and then bring it back to your doctor or your nurse practitioner or your nurse and have those conversations as well. But keep asking the questions and look for the right answer.
That's fair. Any tips, Katie, in terms of, as we spoke with Tara and Megan, they said they kept looking for sources and couldn't find them. What can you say to people who want to get to the source of the information? How do they do that?
Yeah, I mean, I've been down all those rabbit holes. In the research for this story, I watched the documentaries that I'm sure a lot of mothers have watched. I read the studies, I read the arguments, and the thing that I did that convinced me, yes, for sure, I'm sure that this is what the truth is in this investigation, is taking those studies to people that are actually qualified. We're not taking them to someone who has a degree in, gastroenteritis and and asking them about something that they're not qualified to speak on. We're taking that to a microbiologist who deals with pathology, and even that expert will say, well, I can speak to these things, but as for the aluminum argument, I'm not as expert in there, so I'm going to refer you to a toxicologist. And then that person will be like, well, this is why this is not correct, or this is why this is misleading. So I want to assure our viewers that we did look at all of that information, and it was extremely compelling, and it's very convincing. It's scary to hear, oh my gosh, I can't believe this is true. And then you take it to the expert and they say, well, it's not really true, or there's this much truth in it, but here's the context of why that you shouldn't worry about it. So I think, really look at your sources. You'll notice that a lot of the science is written by the same couple of people. The same names you'll see pop up again and again.
That you'll see on
the science,
anti-vaccination movement arguments.
Exactly. On the scientific studies that are cited, it's always the same ones, and these are small studies that have a very specific goal. Whereas if you look at there are a huge wealth of information and studies on studies on studies that have been done and are constantly being done to ensure that these things are safe, because of the fact that they're being injected into healthy people. So it's really important that we make sure that the side effects are as close to zero as possible.
Yeah, something that I tell patients is it's the same science that we use for me to prescribe this medication to treat your blood pressure, or to give you this medication when you're having a heart attack. It's that same science we use to say, yes, use this medication to treat a heart attack, that says, yes, vaccines are safe. It's the same science that deciphers that.
So I hope that you were able to get some clarity if you were unsure about vaccines or anything around it. Can they tweet at Toronto Public Health if they have any further questions?
Absolutely.
There you go. You can get some answers there potentially, and also you can check our articles out on CBCNews.ca. We have 2 very thorough pieces about vaccines and sort of the messaging, the anti-vaccination messaging around it. You can also check us out on YouTube. Our story is up there and you can watch it. All right, thanks so much. Talk to you soon. So I know that, hopefully people can tweet at you, and I know they can tweet at Marketplace as well.
For sure.
So if they have any other questions. But I think that you see the same kind of questions out there. So, and there were a lot of them that we found people asking. So